Another very important topic which you must be aware, it is infertility in men, and male infertility, because there are a lot of patients, which approximately 30 to 35% of our infertile people are men, and these men, they have a oligospermia, they have a semen concentration which is less than 14 million per ml, and they have a low motility, oligoastenospermia, the motility which should be forward progressive motility of 24 to 40%, it will be less than that, or they have no motility at all, is a necrospermia, or they are basically azoospermia. Out of these men, which I told you, the infertile couple, which I told you, in the whole population, nearly 10 to 15% of our population are infertile. So 1/3 of the public are suffering from the male infertility. So it's because of the pollution, because of the endocrine disruptors. So these are the couple where these are the men where their semen count, I said, is less than 14 million per ml, or they have a low motility, or they have a dead sperms, necrospermia, or 10 to 12% of these men with oligospermia, they are having azoospermia, where there is no sperm found in their semen. So out of these 12% of the patient with azoospermia, again 50% of obstructive azoospermia, 50% of non-obstructive azoospermia, where it is a big bulk. So what to do with them? They come to us, we have to help them, because we cannot go for the donor. They don't want, they want to be the father of their own offspring, and that is why the male infertility treatment is very, very important. So what do we do for a mild oligospermia, where the semen count is 11 million, 8 million, or approximately 7 million, more than 5 million? We can do intrauterine insemination, where the semen will be washed by the technique of the density gradient, will be prepared, or by a swim-up technique, and if the sperm count after processing by the swim-up technique or density gradient, it will be more than 1 million per ml. It is a good chance of a success. You may be asking, what is the chance of a conception in IUI, in each cycle of IUI? It's only 15 to 20%. But when we talk about ICSI, where I just now mentioned, in segmented IVF, with the separation of ICSI procedure at freeze for all, and then transferring of the frozen embryo transfer technique, that is almost 90%. We don't tell this to patients, but it is a success. It's a successful procedure. Unlike IUI, which is only 20%. But patients will be lucky to get success, because then we have to prepare them, we have to give them a tablet for ovulation induction, HCG, and then after 24 hours, we do basically the intrauterine insemination after doing the processing by swim-up technique or density gradient. But if the semen count is less than 5 million, or they are having azoospermia, so if the semen count is very less and in less than 5 million, then we have to do ICSI with the procedure I mentioned to you. But if they are azoospermic, what do we do then? It's very important we involve and we invite the urologist with a liaison with the urologist expert in this field, where they do the testicular aspiration, TESE, or per epididymal aspiration, PESE. So these are the patients where after aspiration, the semen sample, the testicular tissue will be prepared to extract the sperms, and then we do subsequently ICSI procedure, where again the success rate of the obstructive azoospermia of the ICSI, it is just like a normal oligospermia, where patients, they will be having a very good chance to get success in one cycle. Of course, many centers I have seen, they do many cycles, which is not right. We have to try to give the patient success in 1 or 2 cycles. If patient does not get success with 1 or 2 cycles of the ICSI, it means the case has to be reviewed. Is there either any molecular problem or any infection problem is there, or immunological factor are involved, where we have to review the case.